Good afternoon, everybody. As much as I love that music that we play going in, what was making me smile was those pictures of those babies. A lot of people don't realize people continue to send me Christmas cards with the babies as they grow up, and I keep them. I have like a drawer that's spilling over with cards and pictures of my babies through the years. So hopefully you guys will join that crew and let me see my babies grow up. All right, welcome to the Full Circle Pregnancy Orientation. And I am your host, Dr. Adams. So, some of you, we just talked a little bit earlier today at your history visit. A few of you, I also saw a little earlier in the week, and some of you have your history visit coming up tomorrow or next week. So, welcome to all. We are going to get started, giving you a couple seconds to get your pen and paper or your notes and your questions because this is live and interactive. We have a few housekeeping items first. We are, oops, there we go. This is confidential. So if you ask me questions on here, no one can see your questions except for me. So please don't feel that there are any silly questions. Go right ahead. I won't read your name and I'll answer them in a way that no one knows that it's you. If I think the question's too personal and someone can figure out that it's you, then I may say, let's hold this until your visit. So please participate. I also have some polls that are scattered throughout here to just keep you engaged. So please answer the polls because it also helps me decide what direction I'm going to take the next couple of things we discuss. And finally, after this presentation is over in a few days, you will get an email from Zoom giving you a link to rewatch it on our YouTube channel. It will be available for the rest of your pregnancies. So we're going to start right now with a poll question, just kind of give you an idea of what they look like. You're going to tell me who's on the line. How many first-time mamas do I have out there, and how many veteran mommies do I have? So this is how we'll do it. We'll put the poll up. You'll have a couple of chances, a couple of moments to respond. And then I will say, and the polls are closing in 3, 2, 1, boom. My host will close the poll, and we see we have way more mommy veterans on the line this time than first time moms. This is still a really good refresher because pregnancy brain, as first time moms are now realizing you can't remember anything. Pregnancy is the same. That's why we keep doing it. So, we're going to go over some of the things that we usually do here, including the full circle experience where we deliver some of our office protocols, what to expect at your visits. We'll give you some prenatal resources, discuss exercise and nutrition in pregnancy, and wrap with a quick COVID-19 update. So, beginning with how the practice is structured, we are a collaborative midwifery model practice, which labors under the pretense that pregnancy and birth are normal life processes. This is not some catastrophe that has happened that we have to figure out how to cure you of this terrible disease. Pregnancy is awesome, it's physiologic, it's supposed to happen. In the traditional midwifery practice, they take care of normal low risk women. But if they identify an abnormality, you may have to transfer out in order to have access to physician care. In the collaborative model, though, the midwives may be running the prenatal care. They are the face of prenatal care here. It allows you to have visits with them so you'll know the person who's going to be at your delivery because you're able to stay in the midwife care with physician direction for any medical issues that come up. So, to that end, most of our deliveries are attended by our certified nurse midwives. That includes our vaginal birth after cesarean, too. I know some of you were my private GYN patients, Dr. Marrow, Dr. Mooney's private GYN patients. And you're saying, but I really wanted a doctor. We are a midwifery model practice. Now, if something happens that's outside of the scope of what the midwives do, which is normal, low risk physiologic labor, they will definitely call one of us. If it's something urgent, like cannot wait until morning, your baby's misbehaving now, they talk to either myself, Dr. Marrow, Dr. Mooney. We are always available. Each of us lives about 15 to 18 minutes away from our delivering facility. If it is a true emergency, as in cannot wait 15 to 18 minutes, our facility does have OB hospitalists, board certified obstetricians who are in-house 24 hours a day. Now, there are not as many true emergencies as you would think. So, to put it in perspective, in 2022, we did two out of 540 deliveries. Did they have to have the hospitalist begin the delivery before we could make it to the hospital? Where do we deliver? Excellent question. We're at HCA Florida Hospital, which is relatively new for us. We moved there at the end of October, beginning of November, and it has been fabulous. As you can see from this review that is here, if you go out to our socials, you will see even more reviews about the new facility. It is still very close to our office, and they are doing tours. In fact, they have a stork tour tomorrow. So if you all have not seen yet, or seen on our social, because we did post, there is a stork tour. It's like a baby shower where you come out and they introduce you to the staff there. You can tour the facility and just kind of get to know your way around where you're going to meet your little one. If you're unable to make tomorrow, they also do one-on-one tours. So there's a phone number that we can give you during your visit, and you can call and set up. They do them in the evenings, during the day, on the weekends, whatever they can to accommodate you. Because they're excited to have Full Circle there, and we're happy to be there as well. They also have classes, including childbirth classes. So there's a comprehensive one that's 5 weeks or a condensed one that's just a weekend. They have breastfeeding classes as well. And for all my veteran mamas on the line, they have sibling classes. It's so cute. So it prepares your 3 to 7 year old and bigger kids for being a big helper with the new baby. And goodness knows you need that. You need a big helper. All right. So, how to engage with us? So, contacting us at the office, we are open at our main facility here Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2, and then we resume seeing patients from 2 to 5. So if you happen to call us from 1 to 2 and you get the after hours line, we're not actually closed, we're just closed. But if you need to leave a voicemail if you're having an emergency, the reason why we use the after hours line is because that does ring to our on-call provider. If it's an administrative concern that you have between 1 and 2, like you're going to be late for your appointment or that sort of thing, please hold on to that until 2 p.m. because the on-call provider does not update the front desk with administrative issues, non-emergent issues. But if your baby's deciding that he or she is coming at 1:01 p.m., please tell the on-call provider so that she can be there to catch. On Friday, we're open from 9 a.m. to 1 p.m. And so if you're having an administrative concern at 12:50 at Friday at 1 p.m., just know we may not get the message until Monday. But if it is an emergency, it does roll to the after hours line immediately after the main office phone is shut down. Next, we talk about appointments. So we do not have walk-in appointments because our goal is to see, as you could see in those reviews, our goal is to see you as close to your appointment time as possible. And we cannot do that if we promised you the 2 o'clock spot, but right at 2 o'clock, someone else walks in and says she needs to be checked for something. That's your time. You booked that time, and I'm not going to give it away. We do have some limited same-day appointments today. I think there were 3 or 4 open slots at various times throughout the day. So if you're calling in the morning with a concern, hey, I really need to be seen, if it's something that we think can wait until our open slot during the day, that's where we'll put you. If there are no open slots during the day, or the one that is available is not till 5 hours from now, and we don't think that it can wait, we may recommend that you go to an urgent care or go be seen on labor and delivery. That is not us saying that we don't want to see you. It is us agreeing with you that this is an urgent matter. It should not wait. You shouldn't be sitting in our lobby waiting to get worked into a full schedule. Also, when you're calling the office, providers are unable to leave the appointments, and I believe you all can already see that slide. We're not able to leave the appointments to take phone calls. So if you're calling to ask questions of one of the providers here, we do have Tony, who is our nurse, and she can take clinical questions. She can also triage basic things, things about baby's movement or spotting or, burning when you go to the bathroom, all sorts of things. Tony can help with some of those, get some answers, even write some prescriptions if necessary. If it's something beyond her scope, she knows how to get in touch with the on-call provider, and she can get an answer for you soon. But the providers are here seeing patients during the day, and if I'm seeing you, it would be rude for me to leave your appointment to go talk to somebody else who called on the phone. If you do call and need to speak with someone, please leave a message in the right place in order to receive a call back. So the right place is Tony, if it's something about letters or forms, she's also our nurse. So she's the one who would triage any clinical matters like bleeding or baby's movements or contractions. She also does FMLA and disability forms. Many of you have already heard from our OB coordinator, Naisha. She's the one who sent you your labs. So your lab slip, she also handles referrals. And if at the end of pregnancy you need something scheduled, like your delivery, induction, C-section version, whatever, Naisha is the one. She also schedules circumcisions for your little guys. And then if you have any questions about insurance, everyone on this call has probably already met with Renee Hall. She's our benefits coordinator. And if your insurance is changing at any time during the pregnancy, please be sure to let Renee know so that she can double check your new benefits and be sure we're not collecting on an old unnecessary payment plan, or we're making sure that we're getting all of this done in a timely fashion. All right. After hours, when the phone rolls over, it goes to the emergency on-call provider. That's always somebody from our office. It's one of our providers. So we don't farm out our provider calls. So this is if you think you need to go to the hospital. And if you call the after hours line, you call the main line and follow the prompts to get to the after hours. You have to leave a voicemail for it to even register that the call came through. You'll hear the message on there that it'll be 20 minutes. If you don't get a call back in 20 minutes, call back. If you feel like you really need to go to the hospital, please don't wait. Just go to the hospital, because the person who's carrying the phone is also the person who's in the hospital. And so she might be pushing with someone or handling some other situation at the hospital and can't make a phone call, but she will be there to help take care of you when you get there. But if you do need a call back, please remember to leave us a voicemail. Next. How to contact us. The patient portal is also a way to contact us. But remember, the patient portal has a response time or a turnaround time of up to 2 business days. So if you send something on a Thursday, Friday's a business day, Monday is the next business day. So just remember that now most of us are pretty good about checking our portal messages, but if it's something that cannot wait, then it should not be a portal message. If it's a non-action item, like, oh, I was just wondering this, and can you answer that question? And you have an appointment coming up, what we may do is pass the message on to the person who's going to be seeing you at your next visit so you can get it answered then, so as not to start a back and forth conversation over the patient portal. The portal is best used for things like, I lost my lab slip. Like, it could wait till my next visit, but I really like to get the labs done before I go back in. Or I have COVID, so I need to cancel my next appointment or convert it to a virtual appointment. As long as that appointment is 2 business days away, then the portal is a great way to communicate with that. Front desk is actually really good about appointment requests and answering those in a timely fashion as well. So typically, they'll just go by the guideline of 2 business days. The portal, remember, is what we do after we've seen patients in the office all day, and then we've done all our charting and we reviewed all of our labs, all of our ultrasounds, and then we go and take a look at our portal messages. So that's really in the time that we're supposed to be spending with our families. So we're happy to try to accommodate some things, but we don't want to have whole appointments there. So please don't send urgent matters like blood pressure concerns, not feeling the baby move, heavy bleeding. Those are not portal messages. Those things cannot wait 2 business days. Those are things that need immediate attention. Please call, no matter what time that's happening. That's something that we want to hear from you about. Also, don't send blitz messages. So multiple messages to the same person, or the same message cut and paste to 5 or 6 different ones of us. We had someone very upset that she had 7 prescriptions waiting for her at her pharmacy one time, but it was because she sent the message to 7 of us. And we each started to work on it. So it's not an efficient use of our time. It gets confusing for you as well. And also, sending the same message or multiple messages will have our EMR think that you are a bot trying to spam us, and it may delete your portal account altogether, and it's really hard to get those reinstated. And then finally, as I was saying, not trying to have a whole appointment over the portal. There's sometimes like you can upload things, so people will upload, pages and pages of research and say, hey, what's your opinion on this? That's an appointment. So definitely text yourself those types of questions, things that have long answers, or if one question is going to turn into 3 more, then schedule an appointment. We are here every day and happy to see you and answer all those questions in real time. All right. Other things released on the patient portal are ultrasound results. In the event there is an urgent finding, like there's something that we think needs a plan today, we will not let you leave the building if there is something urgently abnormal about your baby. Otherwise, we have to download the reports from the ultrasound machine, upload them into our EMR, divide them among our providers, and then review them. So again, 2 business days. Please give us a chance to receive your reports, review them, and respond. Can't tell you how many times I get messages and people say, I just left my ultrasound and she was typing a lot of things. What does it say? I don't know. But what I do know is that it is not urgently abnormal because she let you walk out of the building without creating a plan. Now, if you know that your anxiety will not let you wait 2 business days to find out what's on the ultrasound, be sure that you schedule your OB appointments, your routine prenatal visits after your ultrasound. That way, your provider can get a preliminary report of what is on the ultrasound and just go over that with you. And then you can get updates as they come out on the portal in a couple of business days. Quest also has a portal where they send you the results first, which is kind of annoying to me. And then you get the results and it's all red and it freaks you out. And then you send me a message, look at this. So red doesn't necessarily mean abnormal. Remember that the reference ranges Quest is using are for non-pregnant people. Pregnancy reference ranges are different. So give us a chance to receive the labs from Quest, review them, and release them. We'll typically release with some commentary, like mine is usually, hey, the ones in red are actually still normal for pregnancy. That's okay. Um, but if you've had the labs for over a week, like they've been on your Quest portal for a week and you haven't heard anything from us, then let us know because there's a chance that Quest didn't send it to us at all. And we definitely would like to see them and review them and give you our thoughts on them. All right, any questions on how to engage with us, walk-in appointments that don't exist, that sort of thing? Okay, next. All right, what to expect at your visits. So, one, expect that you will have amnesia and forget all the questions that you had before your visit. So, text yourself questions. Go ahead and start yourself a little text thread so that you can remember everything that you needed to ask us and discuss with us at the visit. You want to wear loose, comfortable clothing so that we can access your belly. Typically, pants are better. The dresses, when you lift them up, like we will give you a drape to cover, but we need to get to your belly. So if you have on a dress, you're going to be pulling the dress up over your undies. So a nice shirt that you can lift, those pants with the belly band that you can put under your belly, and we'll just take a listen. So we will be listening to baby's heartbeat at every single visit. Please get here about 5 minutes before your scheduled appointment so you'll have enough time to check in and handle any business with the front desk. We'll also want you to leave a urine sample if you need to. We're no longer routinely doing urine samples. ACOG says we no longer need to do that. We're only following urine if we're having blood pressure issues and need to check for protein or blood sugar issues, or if you recently were treated for urinary tract infection and we need to do a test of cure. Otherwise, we know you're pregnant. You always have to go to the bathroom. So when you come in, go onto the bathroom and you'll be fine. If you're 10 minutes late, we still have time to check on you and your baby. It leaves little time for questions. 20 minutes late, you have missed that appointment slot, but we may be able to work you into some of the other appointment slots that are open in the day, or we can reschedule to a time that's mutually beneficial. Front desk girls are really good about that. If they see that people are running late, they may shift you over to somebody else's schedule. So if that time doesn't work when you get here, no big deal. Just let them know it doesn't, and you can move to a different spot. All right. Diagnostic ultrasound visits. So the question I always get is, when will I get ultrasounds? Good question. Diagnostic ultrasound appointments are separate from your prenatal visits. The way to know whether you have one scheduled is to look on your portal. So do you have more than one appointment time coming up, and is there a provider's name associated with it? So for example, Tina Test is our test patient here. When she clicks on the portal, when she logs into the portal, she clicks on appointments. And she sees she has 2 appointments. One is at 9:20 with ultrasound, which is not a provider's name. The next one is at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina has her ultrasound appointment, and she can tell her family, hey, meet me there. We're going to be doing this at 9:20. And then they can take off before her next OB appointment, or they can hang around. But she'll have an appointment then, and Dr. Yeckel could be able to go over some of the preliminary results of the ultrasound on that day with her. Remember again that the results are sent to the portal within 2 business days, unless there is something urgently abnormal, in which case we will not let you leave the building. That is today's take-home message about ultrasounds. When you're checking out from your routine visits and your provider says you need an ultrasound coming up, let the front desk know so that you make sure you're scheduling both your prenatal visit and a diagnostic ultrasound visit when that's due. Now, if you think you need more ultrasounds, but we don't have a medical reason to do them, there do exist boutique ultrasounds. These are a couple places around town that will do just fun ultrasounds. They take a look at baby, they do 3D stuff, they put the heartbeat in stuffed animals, all sorts of cutesy things. So these are for informational purposes. There are a few other ones that we're not endorsing these over any other ones. All right, so next poll question. When are you expecting to have routine ultrasounds? And the key word here is routine. So this is the poll question. Gonna need you to answer that. Thanks. All right, because the polls will be closing in 4, 3, 2, 1. Yes. All right, so many veteran mamas on here. I'm going to get all these right answers today. 20 and 40 weeks is correct. We will be listening to baby's heartbeat at every visit, which means you'll have a Doppler to take a listen to the heartbeat, but actually taking a look and doing an ultrasound with the probe for pictures will be at 20 and 40 weeks. All right, cool. Let's scoot over to the website. So this is our website, fullcirclejacks.com. And as I mentioned, we are at a new facility. If you missed the town hall that I had in October when we moved, you can watch the replay. There's a blue link there to click and watch the event and get all the questions answered about why we would do this after we were at Ascension for 9 years. There is a reason, I promise. All right, scrolling down though, you can, we're going to start over here with the providers. So one of these lovely ladies will have the distinct honor of helping you welcome your little one or ones into the world. So there's me, there's my buddy, Dr. Marrow, Dr. Yeckel, Dr. Mooney, midwives Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. This is the best team. Like, I have assembled the best team. These are my superheroes. And you can click on our bios and learn a little bit more about each one of us. Each have an interesting story to tell. All right, over here under patient information, you'll see the obstetrics tab, and you'll know you're in the right place because you'll see all the bellies. And then at the end, you will see the baby. All right, and so first things down here, you'll see our delivery statistics. They are in there all the way back to 2018 because we are very transparent with our numbers here, because many of you are here because of our numbers. You want to know how many of our moms are going to cesarean, how many successful VBACs are out there. So those are available for your perusal, and we'll be publishing our stats soon on our social media. Prenatal care timeline. Let's click on that. So this is what to expect at each visit. And remember, this is available for you to see on our website. So everyone on here has had your first visit, your confirmation of pregnancy. And at that visit, you had an ultrasound and spoke with Renee about your insurance. Then some of you have had your history visit, which is also in that first box. This is where I order your first prenatal labs. So they weren't ordered at your confirmation, they're ordered at your history visit after I've talked to you and found out what blood work I would like to see for your pregnancy. Some of you opted in to genetic testing, which will be done after 10 weeks, and some opted out. At this point in pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your initial prenatal visit, you're coming back for your physical exam, which is just a routine physical. So heart, lungs, all that good stuff, pelvic exam. If you're due for a PAP, you're welcome to get the PAP at that time, but you don't have to. We just need the cervical cultures to complete the labs. So just showing you what labs are actually on there, because again, transparency, we never order anything without telling you. These are the routine labs that are recommended by ACOG and Duval County Health. All right, so 4 weeks after your physical exam, you'll be in for just a belly check in second trimester and talk about what happens in second trimester. And then your anatomy ultrasound, as we mentioned, is around 20 weeks. So you'll also see in that middle box the mental health screen. So if you see a provider on or around that date, She'll be sending something to your phone to just do a little mental check-in because pregnancy can be full of anxiety, could be full of other emotions, and we just want to make sure that we're keeping our eyes on everything and taking care of the whole person. The midwives at this time will start talking to you more about the childbirth education and breastfeeding classes. And then 4 weeks later, you come back and we order another set of labs. So this is where the glucose test comes in, and hold questions about that because I have a whole talk about glucose in just a moment. My moms who have a certain blood type, if you're Rh negative, this is when we want to make sure that your RhoGAM is in place so we can give it to you between 28 and 30 weeks. We will also give you the information to log in and create your portal at HCA Florida Hospital so that you're pre-registered there. You can schedule your hospital tour if you haven't already seen the facilities and figure out who your doula is going to be. And we'll talk about doulas in a moment as well. This is when we start seeing you every 2 weeks. So you'll see there in the middle, you have the option to repeat or decline your standard prenatal labs. And this is more Duval County Health than it is ACOG. So there are different high risk populations in the city who are at higher risk of contracting STDs during pregnancy. If you feel that that does not apply to you, we have a standard opt out form. This is around the time when we start looking at your Tdap vaccine. We do not do that here in the office. We'll send you to either Minute Clinic or your primary care physician for that. Veteran moms, you want to decide if you're going to stay with your pediatrician. First-time moms, you want to start shopping around for a pediatrician. Many of them do meet and greets, and you can figure out who matches up with your child-rearing philosophies. And we continue the every 2 week visits until about 36. Then we do a screen for group beta strep, and we'll talk to you at that time about why that's important. And as you can see, if you've already declined the third trimester repeat labs, you've also declined the repeat cultures. So after this visit, actually right before this visit, the belly birth mamas, those who are expecting a cesarean delivery, which we term the belly birth, the gentle cesarean, we'll get you scheduled when you're around 33 weeks. You can start planning, having your family in town and all that stuff. So at 36 weeks after this, we start your weekly appointments. So after group beta strep is when you can bring in that birth plan so we can go over it because now you're full term and everything's on the table. So weekly appointments until you deliver. If you go past your due date, then we start doing post dates testing to make sure there's still enough fluid around baby and baby's still moving appropriately. We want all tenants evicted by 42 weeks. So for first-time mamas, 41 weeks and 5 days is when we would start a labor induction because our inductions are very slow and gentle. And for second-time mamas, because your labors are usually pretty fast or faster, 41 weeks and 6 days. The average length of labor for first-time mom is 24 hours. I don't think we ever say that enough. 24 hours is what you can expect for the first one. Some people are a little longer. It's just an average. All right, next box, I have a poll question first. If you have a headache during pregnancy, what are you more likely to do? Are you more likely to take a Tylenol? Are you more likely to take a nap, meditate? Or are you more likely to take a trip to the emergency room? Certainly hope it's not that bad of a headache that you feel like you have to go. But the polls are closing in 3, 2, 1, done. All right, today the meditators slightly outweigh the medicators. All right, so some of you have already talked to and you've said, oh, I've had this headache and I've had this, and I know I can't take anything because I'm pregnant. False. Here are some safe medications in pregnancy. So we have them listed alphabetically by common discomfort and symptom. In the middle first, though, you'll see some relief measures. So if you send us a message asking, hey, I've got congestion, what can I do first? We're going to first say, have you looked at the list? Because all these things are on here. So congestion also has allergies on here too, because that's one of the main symptoms of allergies. So your Benadryl, your Claritin, and your Zyrtec is listed under there. Because if the relief measures don't work for you and you're like, I need to make a trip to CVS, these are the things that are okay for you to take in pregnancy, along with some things that we say are not okay. Things that may raise your blood pressure, and also some warnings. Just if you're having nausea, vomiting, you can't keep down fluids for more than 24 hours. Please don't keep trying these things. Please call us so that we can move to either prescription things or hospitalization. So just remember that this is out here. It's 2 pages of good stuff and always changing and evolving. But we will definitely ask you whether you've done everything on there before we move to next steps. All right, this next box on here is gestational diabetes screening. We're not going to click on this one, but I promise my diabetes talk is coming up. Actually, we did click on it, but just know that that's what that says. All right, we're going to go to weight gain and pregnancy because also some of you have said, I'm very concerned. I haven't gained any weight. Or some of you have said, I'm very concerned. I've gained all the weight. So your weight gain in pregnancy is in your second and third trimester. So second and third trimester, you can see how many pounds per week based on what your starting body mass index was. And to calculate your pre-pregnancy body mass index, there's a link here, and you can just put in your height and weight, and it will tell you about how much you should be gaining. If you're having twins, because I know I have at least one set of twins on the line, you can add 10 pounds to the upper number in each one of the middle boxes because twins. All right. And so just don't freak out. If as long as you are staying active and making healthy choices with your food, then your body will do what it needs to do to support a healthy pregnancy. All right. Next box we have here it's for birth preferences. So we're going to click on this one because birth plan. Please no need to scour the internet for all the different things that you could do in labor. We, in the beginning of the practice, we probably got a lot of birth plans. And then, as people kind of got to know who we were, we saw less and less of them. But we thought, it's still a good idea to put all these things down. It helps to relieve some of the anxiety about the unknown of what's going to happen during labor. So everything on here from how you'd like labor to start to what you want to wear in labor. If hospital gowns freak you out, girl, don't wear a hospital gown. Go get something off the Etsy, make it cute. Different types of monitoring. We have options for pain control, relaxation techniques. You can see hydration and positioning on there. The main point of those things is that we do not starve you and strap you to the bed. We want you to be an active participant in labor. We want your baby to be an active participant, and we want you to have enough energy to get it done because it's hard work. If this were easy, men would do it. Sorry, dads who are on the phone. I had to let that one out. Other things on page 2, you can just take a look at them. It may look kind of overwhelming, but every box will not apply to you. Not everyone's having a belly birth, not everyone's having twins, not everyone's having a boy. So if you take it one box per week, that kind of breaks it up into a little bit, and you'll be able to bring this in, talk to the midwives, talk to your doula, see which things are salient to you, and come up with a plan that makes you feel comfortable. All right, so again, just remember this is out there and you can print that out and bring it in after 37 weeks. Cervical ripening techniques, because also after 37 weeks, you want this to be over. How do I get this baby out of me? There are some things you can start raspberry leaf tea as early as 20 weeks, and there are some other things that you can start closer to term. So acupuncture, chiropractic care, evening primrose, date night, also dates, like eating dates, not going on dates, but you can go on dates, but it's more what happens after the date. That's how you got into this. Breast pumps, clary sage, you guys can read. But just remember, all of this is out there. What you will not see on here is castor oil. And if you are curious why, I'll tell you if you have an appointment with me. The midwives will tell you too if you have appointments with them. But just know that this is out there. We do have a way out for you as well. First-time mamas and trial of labor moms. So if you've had a C-section before, do I have any moms who are going for a VBAC here on the line? I think I have a poll question for that. Is there anyone here who's had a C-section is going for a VBAC? Okay, cool. Yes, as you can see, there are only 2 options here. Either it doesn't apply to you or yes, and I'm going to rock it. All right, awesome. So first-time mamas, listen up. This is for you too. This isn't just for moms who are who've had a C-section before, because you're both essentially trying to do the same thing. You're trying to avoid a C-section where not having a C-section is not a given. These are tried and true recommendations to help you help you avoid an unnecessary C-section. So Webster certified chiropractor, yoga, Pilates, taking method specific courses to help you cope with contractions, daily squats, which we'll talk about gaining the recommended amount of weight, hiring a good doula. Again, we'll talk about that too. And then avoiding non-medical induction before 41 weeks. So for first-time mamas, y'all get so tired and you say, I just want this baby out. But if it's a non-medical induction, it is harder. Sometimes baby's not in the right position yet for us to get this little one to cooperate and come on out. But ultimately, trust your body and trust your providers because we want what you want. I don't want you messing up my stats either. So believe me, I'm not trying to railroad you into C-sections. Great. So just remember that this is out here as well. My VBAC mamas, these are things that I did when I was going for my VBAC as well, because your success is our goal. And then finally, here on this page is circumcision care. If you have a little guy and you want to have him circumcised, we do those here in the office when he is up to 10 days old. And this is how to take care of it afterward. If you plan to have this done, we'll ask you again after delivery. Just let us know. We'll send Naisha a message and she will schedule his little appointment and send you a message with that before you get home, usually. It's really good about that. All right. Back to the presentation. So remember, all of that stuff is available at fullcirclejacks.com, so you can go through it at any time. All right, so for those who are very concerned about the weight that they've already gained and are saying, I don't know what could be wrong, Dr. A, I only had a coffee this morning. Did you? Or did you have one of these coffees? A salted caramel mocha monstrosity. Lord, look at the calories. Okay, did you know that pregnancy only requires an additional 300 calories per day? Yeah. And it takes 10 kilocalories to maintain 1 pound of body weight. And your goal weight gain, again, as we discussed, is based on your starting body mass index. So if you're starting the pregnancy at 170 pounds, it's 1,700 calories, net calories, to maintain this. If you need to gain 25 pounds, that's 250 more calories for a total daily caloric intake of 1950. If we divide that between breakfast, lunch, and dinner, that's 650 calories per meal. Now, don't drink your calories. You cannot eat a 650 calorie meal and then wash it down with a 570 calorie mocha monstrosity. Your baby does not know the difference. Your baby will take 300 calories and return the rest to you for Mother's Day. Enjoy. So there are some things here about nutrition, just a couple of little like flip your food over. Like one, you'll kind of be appalled at, the carbohydrates and the sodium that's in everything now. But just when you're trying to make good decisions, when you start sending me messages about my rings don't fit anymore, Dr. A, I'm going to ask you, how much sodium did you have last night? Almost invariably, people say, oh, I did have Chinese food last night. So little choices that you can make for when you're cooking at home to limit your sodium, to watch your carbohydrate intake as well. And your protein we're going to talk about in just a moment, but just remember that this it's a busy slide, but it is out there to kind of give you a little bit of guidance. Next, things that you should be eating: fruits and veggies, whole grains, cereal. You won't give your baby a nut or dairy allergy by eating those things, so enjoy. For my coffee drinkers, you want to limit your caffeine to less than 200 milligrams per day. And remember, caffeine is a diuretic and it's also a heart stimulant. Sometimes we can hear irregular heartbeats on babies at the end and we say, hey, cut out the caffeine, and the irregular heartbeat goes away. So if it's something you can avoid it. But if you can't, just keep it under 200 a day. Herbal teas are fine. Raspberry leaf, ginger, lemon, and peppermint are our favorite. For protein, you want to stick around 70 grams per day. I know there are some pregnancy diets that are out there telling you to cram in 120 grams of protein a day. One, that is just hard to do. And two, you will grow an 11-pound baby. And if that is not what you want your fate to be, then please keep your protein around 70 grams. Too little protein, you'll grow these little scrawny, underweight babies, but 70 grams will get you a nice sized baby. Deli meats, you want, yes, you can have them as long as you microwave them. 30 seconds to make sure you get all the bacteria. They don't have to be piping hot, fresh out of the microwave. Like don't burn your mouth, but just make sure you do microwave. Soft cheeses, as long as they're made with pasteurized milk, those are fine. And you can have canned tuna, up to 3 4-ounce cans per week. If you're a pescatarian and you need more fish, there's a nice document on the FDA website that tells you about which fish you should be eating a lot of because they're high in DHA, which is good for baby's brain development, which ones to eat in moderation, like the tuna, and which ones to avoid because of higher levels of methylmercury. So it's a long document, forever changing, but remember, you'll have access to this presentation, so you can always go back and take a look at it again. What things should you avoid? Undercooked meats and fish. So, if you are a foodie like me and you love everything medium and medium rare, you will need to ruin your food for the next 6 months and have it well done. So sorry. Same thing with that yummy ahi tuna. For my kombucha drinkers, my kimchi eaters, these are fermented beverage and foods, and your body will treat them as such, like alcohol, which is fermented. And so we don't recommend large volumes of those. We recommend no volumes of alcohol, including alcohol-free wine, which for some reason still has alcohol in it. And your sodium total, you want to keep under 1,500 milligrams per day. And again, when you start flipping your food over and realize about 1,500 milligrams, you will be appalled. All right, any questions on food before we move to exercise? Man, this is a quiet bunch. All right, exercise. It is just fine for you to continue your pre-pregnancy activity as long as your pre-pregnancy activity was not doing nothing. You just won't feel like it in first trimester, which is fine. Everybody's tired. In second trimester, your blood volume increases by 50%. You'll get more ability to do that aerobic exercise and you'll just feel better. So those physiologic changes accommodate more activity. Just listen to your body. You will return to being the Spartan Olympian that you were before. Just don't beat yourself up about first trimester. If you weren't doing anything before, it is okay to start a new regimen. Doesn't have to be anything crazy, but please remember the most common reason we do C-sections is not big baby or baby in distress. It is crooked head. Sedentary lifestyles lead to malpositioned babies. So if you are sitting down, especially those of you who are working from home and leaning back in a chair all the time, that encourages babies to descend in the pelvis in an abnormal way. So being upright or fully down is where we like to see you. For those of you with these cute little Fitbit watches that you're monitoring your heart rate all the time, your resting heart rate will go up by 10 to 20 beats per minute. That is normal. That is physiologic. If you are not passing out or getting dizzy with it, don't worry about it. That's what your body's supposed to be doing during this time. All right. Next, for those of you who are saying, well, I do walk a lot, so I think I exercise. If when you walk, your heart rate is in the aerobic zone, which is 70% of your maximum heart rate, then walking is exercise, and that's fine. So how do we calculate your aerobic zone? It's 220 minus your age. So we start with 220, we subtract 30, and that's your max heart rate. So you should not be exercising for extended periods of time with your heart rate above 190 if you're 30 years old. The aerobic zone being 70% of that puts us at 133. So your goal is for your heart rate to be between 133 and 190 sustained for 30 minutes, 3 times a week. If when you're walking, that's where your heart rate is, then your walking is exercise. If when you're walking, your heart rate stays exactly where it always is, your walking is transportation. And transportation is good, but it doesn't count for exercise. So we'll find something else to get that heart rate up. Okay, thanks. What exercises can you do? Treadmill, absolutely. Elliptical, sure thing. Running, you betcha. Swimming, yes. I love swimming actually because it makes your belly weightless. You can do heated pools now and then. You guys are my summer crew, so y'all will have access to real swimming. The indoor bike, if you guys have a Peloton, my leaderboard name is Off My Meds 8. If you follow, I do follow back, and you can keep me honest about how much I'm actually exercising as much as I'm telling y'all to. Other things that are okay, if you were lifting weights before, go ahead and continue lifting up to your pre-pregnancy level. You do not need to increase your resistance during pregnancy. Your baby and your body will take care of that. Squats are my favorite. If you are already an experienced squatter, please continue. If you have not begun squatting at 20 weeks, I want you to start giving me 5 squats a day. 21 weeks, give me 10 squats a day. You are building up to 50 squats a day. They don't all have to be at the same time. You can do them throughout the day. You can do 25 in the morning, 25 before you get in the bed. But that opens that pelvis and lets that baby descend in the right position. I love squats. I can tell who squatted and who didn't at the end of pregnancy. Pilates and yoga also, anything that keeps those hips open and makes those muscles long and lean. Any experienced instructor should know how to do the pregnancy modifications for yoga. All right, things you want to stay away from though. High intensity interval workouts after first trimester. It's not the intervals, it's the intensity. You can do the low impact version of these, but the sudden jerking movements, we don't want to cause any shearing forces on the placenta. Anything that has you lying flat on your back for excessive periods of time, like ab work, So you can do standing abs, you can do side lying abs, but just not lying flat on your back and expending that oxygen. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment in pregnancy, you will get dizzy and fall and possibly fall on your belly. Scuba is a no because of the changes in barometric pressure and decreased oxygen to the baby. Same thing about high altitude hiking. You can visit your family at high altitude, so the Colorado family can still see you whenever you need to see them, but just don't go hiking with them. Contact sports, please do not take up kickboxing during this time. And outdoor biking after 16 weeks has an asterisk because you can still do it, but just know that that's when your center of gravity changes. And when you try to make turns, you're more likely to tip over than you are to actually smoothly make that turn. So just keep that in mind. All right, now that we have discussed diet and exercise, my poll question asks, can you, with excellent diet and exercise, prevent gestational diabetes? I have a lot of veteran moms on the line, so y'all already know. All right. Polls are closing in 5, 4, 3, 2, 1. Boom. All right. The answer is no. The key word was prevent. Can you prevent gestational diabetes with diet and exercise? And that actually makes it seem like there's something that you're doing wrong to make yourself a gestational diabetic. But really, what you're doing is right for pregnancy. You have a placenta. Your number one risk factor for gestational diabetes is having a placenta. That's it. It's giving up hormones. You know, your hormones can make you do a lot of things when you're not pregnant and even when you are. Your placenta gives off hormones too that tell your insulin not to do its job. Insulin's job is to clear your bloodstream of glucose. So when insulin is being lazy, then you have a lot of extra glucose circulating, and that is literally what gestational diabetes is. It is diabetes that is caused by your placenta's hormones. So it's nothing you are doing wrong. This is not about family history. It's not about how much you work out or how much sugar you eat. It's how your body responds to hormones. Okay. So that's why I screen everyone because if you can figure out a way to do this pregnancy without a placenta, then I won't screen you. And some of you have twins, so you have two placentas. I'm not going to screen you twice, but I'm definitely going to screen you. For my moms who say, oh, but I don't ever eat any sugar, you eat good sugars like fruits and whole grains. So don't avoid those prior to taking the test because your body should have an equilibrium of how it processes your good sugars. If it is the drink itself that gives you pause, we do have options for the drink. So there is the Simply Pure drink that is available here at our office for sale. It is soy free, it is dye free, it is gluten free, it is BVO free, it is kosher, it's vegan, it is offensive to almost no one. And then there are some additional patient-driven options that are on the website. Remember that box I said we weren't going to click, but we did click it, but we didn't really look at it. You can go back and click that box because glucorganics, fresh test, and glucose tablets are also options that are listed on our website. If you're planning to do one of these alternatives, please let our staff know when they're ordering it for you because Quest no longer allows outside drinks or tablets. And so we'll need to send you to LabCorp to get that done. And we need to give you the right lab slip and the instructions. Don't open it before you get there. Don't drink it before you get there, all that good stuff. So just let us know if you want to do alternative glucose testing. All right. Preparing for birth, childbirth education classes. All right, I finally have a question. Are you more likely to get gestational diabetes with twins? Yes, because two placentas. Next question is, do you recommend 4 grams of inositol during pregnancy to help control gestational diabetes? I know it's a supplement sometimes recommended to help with PCOS and gestational diabetes. So the inositol actually helps with when it's insulin resistant, and gestational diabetes is a form of insulin resistance. Inositol is actually good for other reasons in pregnancy. It is not harmful, and so if you want to take it as a supplement, it's fine. Don't know if there's any studies on its effect on gestational diabetes, but excellent question. Okay, you guys are out there. Thank you. All right. So these are some childbirth education classes. For those of you who are looking for method classes, this can be for those who are seeking an unmedicated delivery or even just those who want to delay the epidural as long as they can. There's hypnobirthing, hypnobabies. I think Lamaze is on here, Bradley method. So just know that all of these are out here, and this is just the beginning. These are just some that we know from informational purposes, and you can find your own out there as well. Also, Breastfeeding classes. We mentioned the ones that are at HCA. If you're not able to get in with any of those, we can also connect you with La Leche League, and there are several IBCLCs, certified lactation consultants around town that have businesses and would be happy, more than happy, to talk you through breastfeeding. CPR for parents. Every new parent should know CPR for infants. If you already know it for adults, it's not the same just doing it with two fingers. There are different intervals and things, and it's not bad to take a refresher. The first link here is Red Cross. You can always just call them and take one of their courses. And the second one is Jack's Mobile. She'll actually like come to your house and do a private CPR class for you, which is really cool. And then chiropractic care. If you're already seeing a chiropractor, that's awesome. Just make sure he or she is Webster certified, which is a special pregnancy certification that caters to the way that your body changes, the way your spine changes during pregnancy physiologically. Question here. First time mama who's had removal of fibroids, likelihood of having a C-section is high, correct? If you'd like us to review your operative report and see whether they entered into the uterus, we will, but if they did, then yes, we will do a beautiful, gentle cesarean to welcome your little one into the world. All right, we have another question here. Who is planning on working with a doula? I know some of you, I talked to you already, and you were like, I'm 10 weeks pregnant and I already have my doula, my pediatrician, my lactation consultant. I'm like, man, y'all are together. Please do not post on social media. You'll make the rest of people feel bad. All right. Okay, polls are closed. Oh, cool. Look how many of y'all are working with a doula. Oh, that makes me so happy. Very good. And then there are some who are not sure and they don't know what a doula is. I'm so glad you asked. All right. So doulas are there for emotional and physical support before, during, and after pregnancy. So breathing techniques, positional changes, relaxation strategies during labor, helping you to prepare your birth plan, kind of guiding you on what to expect before the process. The best doulas that we work with, come to your house or meet you at the hospital when you're being admitted. They stay with you the entire labor. They're with you and they help you get the baby latched. They do, postpartum check-ins. They are there to make sure that they are advocating for you. Doulas bring us patients, like some of you came to us because your doula is like, you need to go full circle. They like coming to us because they don't have to spend their time fighting the provider about unnecessary interventions. We have a really great relationship with doulas in the community. They know if Full Circle recommends something, then you need something because they would prefer not to do anything to you and just let your body do what it does. So they work really well with us and with our midwives. They don't give medical advice. They help us to explain the medical advice that we're giving. They don't provide medical care. They don't deliver your baby. That is literally what you are paying us to do. And they don't prescribe medicines. We do that. That's what your midwife does. People are like, I have a doula and a midwife and a doctor and a nurse. And who are all these people? You have a whole team working on you. It's like you're going to the Oscars. I have a couple questions down here, and it is, can fibroids and cysts be a cause of concern or be considered high risk? No, during pregnancy, actually, neither of those things are issues. Fibroids depend on the size, and that one we'll discuss during your visit because that will be specific to you. But ovarian cysts typically no. So if you're looking for a good doula, remember, like I said, we do quite a few of our births with them. So feel free to ask the midwives for recommendations for the ones who we've seen support our moms the best. Acupuncture and pregnancy massage. When you come out of the bathrooms in the front of the office, there's a row of business cards up there. A lot of people who do acupuncture and pregnancy massage that we vetted, and we know them, and so we let people who we know put their business cards out. Again, not endorsements, but just we do know who they are. All right, breast pumps. Many of your insurance companies do cover breast pumps. So we have already found a company that makes it really easy on both of our ends. So please don't go find your own company to figure out the breast pump dilemma. We have QR codes in each of the exam rooms. When you come in for your anatomy ultrasound is a good time to do it. Just scan your QR code and they will and fill out the form and send it to them. They will communicate with your insurance company, figure out which pumps are covered, send back to you what your choices are, write the prescription, send it to us for signature, and then mail it back off to your insurance company. Super easy. It doesn't require a lot of extra additional unnecessary information on our part. Sometimes when you guys go out and find your own company, they want a record of how many visits and what your blood type is and all this other unnecessary stuff. and it just delays you getting your pump. So please scan our QR code so that we can all do this efficiently. Appreciate you. Great. Postpartum care, because one day you will deliver. Blood pressure check. So, for mamas who have any issues with blood pressure during pregnancy, and 1 in 10 mamas who had no blood pressure issues before will have a blood pressure issue during pregnancy. We see you back after pregnancy sooner, usually within about a week. For my mamas who have a belly birth, incision check is at about the 1 to 2 week mark, and a routine mental health screen. We want to do check-ins for those who have identified themselves as being at higher risk for postpartum anxiety or postpartum depression. We're not just going to wait 6 weeks and let you flounder out there. We will be checking back in with you. Postpartum doulas are a thing. And so just remember, if doulas are there for physical and emotional support, what better time than postpartum for that you need emotional and physical support? The motherhood space is another invaluable resource that's here in Jacksonville. We were one of 4 or 5 cities in the country that were given a grant to create this program. And it is an amazing space at the YMCA downtown. Dr. Jill Garrett does group therapy, one-on-one sessions. They do yoga. They have free childcare for babies 6 weeks up to 12 years of up to 12 years of age. There, they do walks on the river. I mean, it is very therapeutic and amazing, and they communicate back with your providers if they think medication is necessary as well. And then pelvic floor therapy. Oh, I'm actually doing a podcast with Dr. Garrett on Friday regarding postpartum care. We'll be announcing on our social when that's aired. Pelvic floor therapy, we have that here in the office because this is standard of care in Europe. In America, we're catching up slowly. But babies change things, and not always for the better. Sometimes you're leaking urine, you have a sensation of heaviness, sex becomes uncomfortable. And so pelvic floor therapy kind of helps you to rehab and get everything back as close to where we found it as possible. So typically right at 8 weeks, we start you on a weekly venture of coming in to do pelvic floor therapy. All right, next question I have up here is, should I stick to 70 grams of protein daily for twins, or do I need more? You just add 10, so 80 grams should be good. All right, good question. Random frequently asked questions. Yes, you can sleep on your side, your left, your right. You can sleep on your back. Yes, you can. If you're getting dizzy when you sleep on your back, though, you can put a wedge or like get one of those wedge pillows they sell on Amazon, put it under one of your hips so you can't roll all the way over onto your back. You can help paint the nursery as long as it is a well-ventilated room and you're wearing your mask. You can take probiotics during pregnancy. You can also dye your hair, which includes your eyebrows. You can get gel nails. If you're sitting in that salon with all those fumes, though, you may just want to wear a mask just so you don't get sick. Car travel, y'all are my summer break people, so your kids, you're taking them on vacation. Car travel is fine up to 37 weeks. After that, the baby thinks he or she is fully cooked. So please don't have a baby on your summer vacation out of town. Just make sure you're getting out and stretching every 2 hours, which you will need to do if you're drinking the right amount of water. You can also do your skincare, your benzoyl peroxide, your salicylic acid. Those are fine. Those are topical things. Just nothing topical with retinol in it. There is an alternative. It's called Bakuchiol, Bakuchiol, and it's a retinol substitute that is not harmful in pregnancy. Air travel, flight is fine for my twin mamas up to 32 weeks, for my singleton moms up to 36 weeks. Just please, please, please be sure you are wearing your compression hose, you're drinking lots of water, and you're doing toe raises to make sure that you keep your blood circulating so that we do not get blood clots on the plane. Things to avoid, again, because y'all are my summer crew, no roller coasters, no water slides. Don't go chasing water slides. Topical tretinoin is not okay to use during pregnancy. That's the question that I had up here. Is topical tretinoin okay? And that is a no. All right, last thing, y'all. Thank you for rocking with me. We're almost done. COVID-19 update. So vaccinations. ACOG moved from support either way to strongly recommend based on the New England Journal study of 35,000 pregnant women. Moderna and Pfizer are okay. Johnson & Johnson is not recommended because of its independent risk of blood clots combined with the pregnancy risk of blood clots. In terms of boosters, all of them have been approved for boosters. So if you are more than 6 months past your Moderna or Pfizer, it is okay to get a booster there. If you are 2 months past your Johnson and Johnson, it's okay to get a booster, but not Johnson and Johnson. And mixing and matching is we should be on the. I'm sure you guys are seeing this next slide. 2 months past Johnson and Johnson is not you can get a booster, but mixing and matching is okay. So you can get a Moderna or a Pfizer. There's no optimal time for this versus the Tdap or flu or RSV vaccines because they work differently. If you do get COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we do not prescribe those. Next question is here, do you require moms to get, and all the vaccines are listed here. It is personal preference. We don't require them. We just give you what the recommendations are. If you do get COVID, these are the things that we recommend: vitamin D3, zinc, vitamin C, and a low-dose aspirin until your 36 weeks. The low-dose aspirin is because we've seen increased numbers of gestational hypertension, so high blood pressures at the end of pregnancy with moms who've had COVID during pregnancy, and we know aspirin will reduce your risk of that by 40%. We do start serial growth ultrasounds after your anatomy ultrasound following your diagnosis to make sure that baby is still growing appropriately after a COVID diagnosis because it does affect the placenta and the blood vessels. So if you do contract COVID, a recommended course is supportive at home. See our website for a sore throat and scratchy congestion and all that stuff. You only need to go to the hospital if you're having difficulty breathing. So respiratory issues or a fever that's greater than 101 that you can't break with a normal amount of Tylenol. In terms of being at the I think the next slide there. In terms of being at the hospital for COVID, we're back to our usual 4 visitors plus your DONA certified doula. So that's what we were prior to COVID. We're not routinely wearing masks in the hospital or in the room. You're only masking if you are actually COVID positive at the time of admission. And if you do have COVID when you're in labor, we're not separating moms from their babies. You're given an isolette and you're given an N95 mask so that you can still breastfeed. All right, last question. And I know you're all going to get it right. What can you find on the website? What information is out there? Can you find the birth plan template? Can you find safe medications in pregnancy? What to expect at each visit? Or are you an excellent test taker and read all the way to the end and know to pick the right one? Oh, the question I have here is how many people are allowed in the room during labor? And that was your four visitors plus your DONA certified doula. So 4. There we go. Sweet. All right. Are there any more questions? You guys were awesome. This was a great crowd. Please remember to follow us on all the social things. We are there. We have Facebook. We have X, formerly known as Twitter. We have Instagram and we have YouTube. And we will be making a lot more announcements because I have a lot of things coming up now. Full Circle is doing quite a bit in the community. So we have some exciting things that we'll be sharing with you really soon. And don't forget birth stories. Birth stories matter. I talked to a woman just today who was like, I had a really great birth, but I don't like telling my story because, people have problems. And I was like, no, you're the one who needs to tell your story because this is what we're here for at Full Circle, not the drama and the trauma of birth. It is one of the coolest things your body's ever going to do, and it should be celebrated and people should be talking about it. So when you have your warrior rock star birth, please be sure to share your story with us so that we can inspire the next set of Full Circle mamas. Thank you guys for rocking with me. I appreciate you so much, and we will see you back in the office really soon. Mwah.